Strep A infections have been rising across Australia for the first time in 2 years. Infections are often mild, but if they are left untreated, it can lead to a deadly but preventable disease, rheumatic heart disease. Joining us live with more on this is the Telethon Kids Institute Infectious Diseases physician and researcher, Dr. Thel. Dr. Haller, I really appreciate your time. Thank you. Firstly, do we know why Strep A is on the rise at the moment in Australia?
So that's a very interesting question. I think a lot of work has been put into it at the moment. So we're not quite clear on that subject just yet. It's not just in Australia, across Europe and in other parts of the world as well. We've noticed a rise in Strep A infections, and that may or may not have something to do with the pandemic and the social distancing. And so that's still sort of being studied as we speak, yeah.
That's quite a hotly debated area, isn't it? The so-called immunity
It is, yeah.
And a lot of commentary around COVID and how that impacts our immunity to other illnesses.
Absolutely, and how it affects the other seasonal bacterial infections. As one of the Strep A is a human pathogen. It only causes disease in humans, and it's been with us a long time. So how that epidemiology changes with what we have just gone through in the last 3 years is sort of a lot is up for speculation, but the jury is still out because we're still sort of gathering all the pieces of information we need. And whereas, my field of research is not, it's related, but it's sort of tangentially related in the field of acute rheumatic fever and rheumatic heart disease, which is a small subset of what Strep A can do in vulnerable populations. So it's not quite the same for everybody. So not everybody is at risk of acute rheumatic fever or rheumatic heart disease if they get a strep throat, for example. And the reason we're doing research in this field using this way is not to sort of say how to treat Strep A better, but it's just to determine how we can protect the vulnerable children and young people from Strep A in certain situations.
And so just talk to us a bit more about Strep A and how that can lead to those heart issues. What are the symptoms, for example, that parents should be aware of? Just how quickly can it progress?
Yes, so I guess in this context, you're talking about invasive Strep A infections, and those can be very rapid. It may start off as, anything like another virus, sore throat, fever, but then the child may become rapidly lethargic. And if it's picked up early enough, it can be treated quite effectively. I might just preface by saying I'm not a pediatrician. I don't often treat children, and I certainly sort of feel for people who have to work in pediatric emergencies who have to recognize this coming through. So my field of research is finding out the sort of how to prevent Strep A better, because once you get an episode of strep throat, and if you are a vulnerable child, let's say living in remote communities, having very little access to medical care, or not being able to see a GP, then the body's immune system, what we call the autoimmune response, can actually harm the body's nerves, your heart valves, and this thing's called acute rheumatic fever. And if you have several episodes or even a couple of episodes, over time, it actually leads to heart damage and what we call a rheumatic heart disease. And so by the time you're a young adult, your heart may be failing. And so people can sort of die of heart failure in their 30s, which is a very premature death. And this condition, acute rheumatic fever and rheumatic heart disease, is separate from the invasive Strep A infections that we see, which can happen in anybody. But the acute rheumatic fever, rheumatic heart disease sort of goes hand in hand with socioeconomic sort of factors like poverty, overcrowding, lack of access to medical care, and that's quite preventable. So whereas with the invasive Strep A infections, the Strep A is all around us. It's not a particular place that you pick it up from, and not a particular risk factor. So that can happen to almost everybody, and it's hard to predict, when that occurs.
Okay, so it sounds like to avoid those sort of major heart issues you're referring to there in kids, it's really important to treat that strep A ASAP. I understand that you're calling for volunteers to trial some medication. Tell us a bit about the study you're doing and what you're hoping to achieve.
Yes. Yeah. So we're hoping to see, 60 healthy young people come forward to put themselves up for strep throat. It's not as scary as it sounds. We've selected the strain of Strep A very carefully. A lot of work has gone into sort of manufacturing this very safe strain of Strep A that will only cause a sore throat and they haven't got the ability to cause the invasive infections like you've been hearing on the news. And so what we're hoping to find is by giving these healthy people a mix of penicillin and then giving them a challenge to make sure they're infected, whoever breaks out into a sore throat, that will be what we're looking at. And who breaks out into sore throat or who doesn't will then give us an inclination of where that level of protection is. And what it means, that's a lot of sort of very nerdy jargon, but what it means is that we're hoping to come up with a better way to prevent acute rheumatic fever and rheumatic heart disease. Because at the moment, penicillin works, we know that, but to prevent it, we have to give very painful muscular injections to young children every month. And as you can imagine, if you're a 5-year-old having to have a painful injection every month, you will not come back to clinic, or you'll be very afraid of clinic. It's very traumatic for everybody involved. And we think we can do better than that. We can come up with a better way. But at first, we need to find out what the target is. And that's what my research study is hoping to do. Through, altruistic, healthy volunteers who are willing to go through a short period of very mild illness, which is strep throat, for the benefit of children and young people living with rheumatic heart disease and acute rheumatic fever throughout the world and in Australia, where we've got one of the highest rates in our First Nations peoples. So yeah, it's
Dr. Thel, look, it is always fascinating to hear what our top researchers are up to and what direction you're taking that research in. We really wish you the best of luck with it. We hope it's a success and you can come up with some breakthroughs. Thanks so much for explaining it to us.
Yeah, thank you. If anybody's interested, recruitment is going live at the moment, so they just have to search for linear.org.au. Thank you.